Welcome to Ideagen TV. We are ecstatic today to have Mohamed Younis, editor-in-chief at Gallup, with us today. Mohamed, welcome.
Thank you, George, and hello, Ideagen community. It's always an honor to be here, and it's an honor to be part of this year's summit. When George reached out and asked me to kind of share what Gallup was up to, I had a lot to share. So I'm going to do what I usually don't do, which is share slides. And I'm going to take you through sort of what we at Gallup have been tracking as the COVID-19 crisis has impacted the world. I'm going to start off, really the most of my presentation will be what we found in the US. That's where we've been most frequently polling. But we've also already began polling across 10 different countries, mostly across Europe, as we rely on phone interviews in those countries. And I actually have a wonderful webinar coming up on our plan for how we get back to face-to-face polling in the age of COVID around the world. But today, I really wanted to take you through what we've been learning. Before we look at numbers, I kind of wanted to tell you why we care. A lot of people know Gallup for our political polling, but really since our founding in 1935 and Dr. George Gallup himself, our passion has been to try to understand how people are living their lives in a way that's reliable, measurable, neutral, and objective, but at the same time in a way that helps leaders make better decisions about those they lead. So whether it's across society, as we'll be experiencing today and seeing today, but also within workplaces, within organizations, what we're focused on doing is using not only survey research, but really all research methods available to us to understand what's happening and how people are actually living their lives at the local level. Here, I just wanted to kind of share in the context we bring to this is really tracking major crises here unfolding in the United States since the Great Depression through all of these important moments in the United States. Since 2005, we've also been polling globally in 140 countries, covering 96% of the world's population, and I will be talking a little bit about that as we go on. Just to share some of sort of the top lines that we've gathered, and these first few slides will be data from our Gallup panel, which is an online survey that we do here in the United States that is nationally representative, but is a different tool than what we usually use to do, for example, presidential approval, which is usually through our RDD or random digit dial method. So what we really wanted to track is a series of things, basically as many dimensions as we could about the crisis itself and how people are reacting. Here, you see the social distancing really plateauing in April, whether it's asking people if they're avoiding public spaces, avoiding small gatherings, or avoiding travel there at the top. There's really a peak in mid-April, and it's began to wane down. And one of the things we'll continue to track is looking at states that have really began to open up, business as usual to some degree versus others that are still under direct isolation orders from their governors or their representatives. When we ask about specific activities, we've obviously found a recent uptick in people saying that basically they're leaving the house to go to someone else's house or to visit a restaurant. Here in May, in the past couple of weeks, we are basically asking 1,000 respondents every day what they have been doing on a whole variety of these behaviors. And all of the data I'm sharing here, of course, you can find it on news.gallup.com in more depth. But here's a quote by my colleague, Dr. Jeff Jones, that more Americans are venturing out in public, but most are still isolating. And I'll highlight a little bit more of the detail in that later. When we ask about using face masks, we see now essentially that by mid-May, Americans have sort of plateaued in their responding and saying that they're wearing a face mask in the past 7 days when they leave the house. So like social distancing, I think this is going to be another interesting metric to follow when we see it kind of plateau and start to wane off differently within different localities, but also across different subgroups within the population. One of the interesting things about a lot of these metrics, particularly concern about contracting the virus itself, have been the partisan divisions that have arisen. Here, we ask Americans whether they think it's better to stay home as much as possible to avoid contracting or spreading the virus for those that are healthy, or whether it's wiser to sort of lead their normal lives as much as possible and avoid interruptions to work and business. And what you see is at least through May 17th, 71% of Americans still say that they think it's wiser to stay home as much as possible. This is one of the items where we've seen a really interesting partisan divide where Republicans are noticeably actually about twice as likely to say that they are essentially ready to go back to doing what they do normally. And Democrats are twice as likely to say the opposite. However, as of at least late May, at least half, just over half of Republicans still say that response there at the top, that to stay home as much as possible is wiser currently. Obviously, this will change and we'll continue to track it. But when you think about the implications for a response to this, the economic implications, of course, for businesses, for people getting back to normal, per our estimates, before all of this happened, um, about 50 million American households were basically living paycheck to paycheck. So as the interruptions to business really uh, crank into Americans' financial experience, the pressure to open obviously is increasing in a lot of places. I mentioned that we do a lot of work on workplace as well as the human experience and human behavior in society at large. Here, we've been asking Americans whether or not they've worked from home in the past several days. And not surprisingly, obviously, we saw a huge increase in the rate of those saying they are, in fact, working from home as the stay at home orders were unfolding across many of the states. What's interesting, and I think what's important to contemplate for platforms like Ideagen, and this is probably one of the least surprising data points, but I think one of the most interesting that I wanted to share, and here's why. When we ask those that are working from home if they want to remain working from home after the crisis sort of fades into the distance, about half of them actually say they want to continue to work from home if their employer would allow them. And I know that this is a community and a platform here at Ideagen where we're not only part of our community, not only really important technology companies, but really important global employers that are managing this right now. One of the things that we've been doing at Gallup through our one of our leaders, Larry Emond, out of Irvine, is doing a roundtable with CHROs, people who are on the front lines of the largest employers in the world, dealing with how do I navigate the fact that half of the folks at home now want to stay home? What does that mean for me as a business? What does that mean for our managers in terms of employee engagement? What does that mean for our office space in terms of how we organize ourselves? What does that mean for supply chains if you're in the manufacturing industry? So that's the first point, is really how much this is going to impact the workplace is one of the areas where we are most interested and have been doing the most research and will continue. The other point I want to make, and I think is relevant to the Ideagen community in this platform, is really the flattening of technology vis-a-vis opportunity. When you think about immigration, for example, a lot of the SDGs and a lot of what is behind the efforts around the Sustainable Development Goals are really to create better realities in developing economies for people to not need to leave their home economy for a more mature, more developed economy for opportunity. When you think about the flattening, if you will, geographically of the fact that we're all now connecting virtually, and sure, things are hopefully going to go back to normal in many regards, but the opportunity now for organizations to tap talent across the world simply through having somebody that has a laptop or an iPad and a pretty solid internet connection, which is something to not take for granted in most societies, I think is going to be really important not only for employers, but also for economies. When you think about remittances, immigration, and folks leaving home and sending money back from places of greater employment opportunities. So the first point is really how does it change the workplace and managing teams? And the second point I think is relevant is how does it change the opportunity game, particularly for those in less developed economies seeking higher income jobs? A lot of the focus, obviously, around COVID has been around healthcare. One of the things that we've done a little bit more in depth than some of the other topics is really focused on how Americans are perceiving their access to hospitals and services. I'll actually get into healthcare in more depth in a minute, but this is just a question we ask where we say, how worried are you about following the following in your local area? And what we're showing here are those who say that they're very worried or moderately worried about the availability of coronavirus tests and the availability of hospitals to have supplies and services that they need locally. So we saw obviously in the beginning of April a pretty high concern, 6 in 10 Americans. That has waned quite a bit, and this varies from location to location. One of the things about local hospitals and services is when we ask about various actors within the COVID crisis, from nationally elected officials to your local hospital, medical workers of all kinds, the media, local hospitals actually get the highest ratings. That and employers, surprisingly, I think for some, get the highest ratings in terms of Americans saying that they're attacking the crisis effectively. Those that get the lowest ratings go to the media. And also, nationally elected officials tend to do a lot worse than local officials, like the state health officials or governors, for example, versus folks leading in the White House or Congress. This is a question that we're tracking to really get at the pain point between people's concern about the virus and the financial hardship that they're experiencing and pushing them to get back to normal. And it's very simply just asked whether you're very or somewhat worried or not worried at all, et cetera, about getting the virus. And also about experiencing financial hardship. We ask these as two separate questions. I know that the connection of these two questions has been a really important political issue. We're determined to ask them separately and just compare what is the rate of Americans who are reaching that level of worry with each. Interestingly, in May was a point where we saw 53% of Americans say that essentially they're experiencing financial hardship. Their worry level on that has a little bit higher than those that say that they're worried about getting the virus. Essentially, that's within the margin of error and not statistically significant. So right now we're kind of at a stalemate. If you look back in April, you see a really big difference in a noticeably higher rate of those saying that they're concerned about the virus. We've asked Americans how money worries or how this has impacted them financially. We haven't seen a lot of change on these metrics. It's interesting that when you ask Americans about their own personal situation, and we've reported on these on our website for those of you that are interested and kind of go through the details. I won't read them off here, but there's much less impact on Americans' perceptions of their own financial situation and how it's been taken a detriment to the coronavirus situation than it is on the national situation in terms of economics. And I'll get into that in a second. One of the things, actually, I want to back up and get into that now. So you'll notice here that only 9% of Americans say that they basically, compared to this time last year, this was in April, are not able to pay their rent, mortgage, or other housing costs. There's only been a 9% bump year to year. But where we do see a huge decline is in Americans' assessment of the national economy. One thing that we've been measuring for decades now is called the Economic Confidence Index. It's essentially based on two questions, asking Americans how they assess the current economy and their perception of how it's going to unfold in the near future. And in April, we saw a 54-point drop. It's essentially a zero is kind of the neutral point, and you can go up to plus 100 and negative 100. We saw a 54-point drop in 1 month. And that is the largest drop that we've seen in our tracking since 1992. So that's Americans' assessment, essentially, of where the economy is heading. Interestingly, Republicans actually were more likely to drop in the ECI, in the Economic Confidence Index, than a lot of other subgroups and than the national average. So Republicans actually dropped 72 points. I think what's really interesting about this statistic in particular is that it's not only a relative low, but it's a relative low coming immediately after a 20-year high. So assessments of the national economy have really taken a huge collapsing dip. It's not only been a decline, but a very precipitous one in terms of Americans' assessment of the future. And assessments of the future are primarily what are driving those declines. And as when we get into life evaluation and well-being, you'll notice that as well. Quickly here, I just want to show you mental health and suffering is a huge topic, of course, in addition to physical health with this crisis. And we've been asking Americans how long they feel they can go before each of the following happens. Basically, your mental health suffers, you experience financial hardship, or your physical health suffers. And you'll see that here on the left, Americans are much more likely to say that they're already experiencing mental health suffering than saying that they're experiencing financial hardship or physical health suffering. And we see that on many of the metrics that we've been gathering. If you're interested in all the other topics we've been following, and I'll talk a little bit more about healthcare in detail, but we really have been trying to tackle this from many different angles. We have a lot of content on our website, our podcast. We've been doing many webinars on deeper dives into the different dimensions of the crisis and the data we're gathering. But because, again, healthcare is such a critical part and access to healthcare of the SDGs and what Data for Good and Ideagen is all about, I wanted to also share some of the data we've been gathering with our partners at West Health. West Health is a healthcare organization in Santa Barbara, California, which for me as a kid from LA is basically paradise. And I always envy our partners there for living and working in Santa Barbara. But they're very passionate about healthcare policy and how it impacts access to quality healthcare and the cost of healthcare. What we've been asking is a series of questions about the COVID-19 situation specifically and how it impacts people's perceptions of healthcare. What we're finding is that 22% of non-white respondents, and it makes them twice as likely as white respondents, basically say that if they'd have a family member that had a fever, a dry cough, or other symptoms, they would avoid seeking treatment due to concerns about the cost of care. So I think like many developed countries, Spain, Italy, others, the pre-existing healthcare crisis in the United States has really taken a toll on the ability of the country to respond to the crisis. But here we see through these data, people really responding, and those communities with lower educational attainment levels and age discrepancies in terms of them saying that they're essentially avoiding healthcare or would avoid healthcare because they're concerned about the cost of care. We also asked whether if you thought you might be infected, would you avoid seeking treatment due to concerns about the, excuse me, cost of care. And this is the same statistic, but played out, it essentially means that 23 million Americans will avoid that for fear of cost. We also ask whether people have been denied care because hospitals are basically over capacity. Not surprising, in the Northeast have been the highest rate of Americans who say that. 11% of Americans in households making under $40,000 also say the same. 9% of young adults under the age of 30, and that makes them twice as likely to say that they're being denied care because hospitals or healthcare facilities are over capacity. We've also been asking how people are feeling, and we also always do across the world. Well-being and tackling it from multiple dimensions is really a core topic for us at Gallup. Most of you have probably heard of the World Happiness Report. A lot of the data in those reports come from the Gallup World Poll and how we measure life evaluation. We measure well-being in two ways. One is the one I just mentioned, life evaluation. This is about positive and negative affect, or basically various positive or negative emotional experiences throughout the day previous the survey or interview. So what you see here is the stark rise. That's a pretty significant rise for the United States on worry and stress experienced the previous day, but a slow decline as the crisis has sort of waned. And it'll be interesting to see how that plays out. Obviously, we've seen non-whites. The numbers on these are more negative than white respondents. Same thing with all of the things you would assume about lower respondents of lower socioeconomic status than higher, whether it's education, income, et cetera, are experiencing more stress and worry than those in those higher categories of all the variables I mentioned. This is probably the most important metric that we've been gathering honestly, across the world, but also here in the United States. This is the other way we measure well-being, and it's based on something called the Hadley-Cantrell's Life Evaluation Scale. And on the right, you'll see basically the question that we ask is to imagine your life on a ladder where 0 represents the best possible life, and the bottom of the ladder essentially represents the worst life. We've asked people to assess their lives today and in the future. We've been asking this question essentially since 2005 all over the world. And it's been one of the most interesting to track. I've, in previous Ideagen gatherings, shared some of the findings from whether it's countries during the Arab uprisings or the war in Ukraine, the Brexit vote, the election of Donald Trump. Many of the sort of unpredictable political events that have been taking place globally, we've seen a decline in particularly this metric as those events have just begun to unfold. What you're looking at here is a lot of data, so I wanted to give you a chance to kind of just absorb what's here. This is the rate of Americans who evaluate their current and future life well enough to be considered thriving in the metric. So all we ask a respondent is to pick a number today and in 5 years, and then they fall into either the thriving rate, which is people that are doing the best, the struggling rate, people somewhere in the middle, and suffering rate, people who are assessing their lives the worst, and that's based on their numeric response. What you'll see across the left to the right of the graph are essentially a series of events in American history, recent American history, whether it's the Lehman Brothers economic crisis in 2008, the election of President Obama, the election of President Trump, and what the thriving rate in the country looked like as those events were unfolding. I think the most interesting and most critical probably to compare is the 2008 crisis, where we saw it dip to exactly where it is today in America during the COVID crisis. But again, like those economic assessments of the country at large, where you really see a massive decline is in Americans' assessment of their own experience, their own lives. And that rate of thriving is now back down at the lowest that we've gathered in terms of collecting this metric specifically in this way here in the United States. But you'll see that it's dropped from a 55 much faster than anything we saw back in 2008 and the 2009 crisis. And again, all this does, this slide, is highlight the fact that where we've really seen the change is not in people's negative assessment of their lives today, which is really interesting, but more so in their negative lives of the change into, excuse me, not only in their negative assessment of their lives today, but when you look to the future, they still have hope. So if you see that average change over time in their current life satisfaction being between 7 and 10, we see that a lot of people have taken a serious dip. But in terms of anticipated life satisfaction, those who rate their lives at 8 or 10, we've actually seen an improvement. So hope has actually, strangely, ironically, gone up. I think it's because one of the things to consider is in comparison to what people are experiencing today, there's obviously an expectation that things will get better in the future. Obviously, at Ideagen, we're very focused on SDGs. I wanted to mention to those of you that are unaware that we are tracking 3 of the SDGs currently across the world. Modern day slavery in partnership with the ILO and the Walk Free Foundation. We are also measuring malnutrition and hunger with the FAO and the United Nations, as well as financial inclusion with the World Bank. One of the things we've been very passionate about doing as we now deploy our polling capacity across the world beyond just where we do phone um, is really looking for partners to help us track what's happening with COVID and how various institutions and countries and actors are responding to the crisis, where the need is the highest, and what that need is. At Ideagen, I know we always talk about data for good. And I've been fortunate to be a part of many wonderful conversations with some of the most critical organizations in the world that have data at the heart of what they do. We are one of those organizations. We see it as our responsibility to use what we've built, the Gallup World Poll, which is primary sampling units that are now consistent across 160 countries, to try to get a reality from the ground view of how this crisis is unfolding for people, not only in terms of healthcare, but also in terms of their economic challenges. The trust in vaccines is something we're already tracking across the world with our partners, Welcome Trust. And I would only encourage those listening that if you are in an organization that's passionate about this, to reach out to us. We are always looking for opportunities to do good and to use our tools to understand what's going on with these crises across the world. Thank you. I wish you all to be well. And for those who are more interested in our content, I encourage you to go to news.gallup.com. And with that, George, Christian, I hand it back to you. Thanks for having us.